Okay, well, the thing on the lips of every South African these days, corruption, how bad can it get worse? So in terms of this proposal, yeah, it can actually get much worse, but if that's hard to believe. So the NHI fund, just as a very high-level analysis, will be funded through a combination of general taxes, and there's NHI-specific taxes, which not yet been decided, but what's been put on the table is a combination of payroll tax, VAT, or income tax surcharge. Now, and then what it will do, as I said earlier, it will nationalize the private sector, so force them into contracting with the NHI fund, because the private providers will not be able to contract with medical schemes in the NHI world, or for very limited services that the NHI fund doesn't cover. We also don't know what that is yet, so we have a policy process in which we don't know what it's going to deliver, but I suppose that's never stopped this government. The income target for the NHI fund has been pegged at 8.5% of GDP. Now, I want to emphasize this is not a costing analysis. There has been no technical costing analysis done. And in actual fact, Treasury is so quiet on this whole story, it almost seems to me that they're too scared to go down this road because it's just a number that they cannot get to. But the target in certainly both the white papers of 2015-17 had this as the target. And that in just rough numbers that I looked at our GDP, that's about 500 billion per annum every year. That is 2.5 times the size of Eskom. And like Eskom, it would become a state-run monopoly. And I mean, obviously, we can just see what happens with our current state-run monopoly. It's not working very well. So I don't know if you can have healthcare shedding, but maybe it'll enter the South African parliament. Are we already there?
No, so it's called death.
Oh, yeah, okay. Death and taxes, your only certainties there. Okay, so slightly more detail around this structure. There's a board that will obviously control the NHI fund. There are a number of committees. I think there are 9 in total. I'm just going to cover a few here. There's an accreditation committee. Now, this committee will decide which providers, those at the bottom there, which private and which public service providers will be accredited in order to contract with the NHI. So you can imagine in terms of the brown paper bags are going to be swirling around to get a contract in an area, because you don't get a contract, then you're out, you're gone, because you can't go to the medical schemes to contract because you'll be prohibited from doing that. So it's a binary. It's binary. You're either in or you're out. You're gone if you don't make that accreditation committee. There's a benefits pricing committee that will determine what you'll be paid if you're a service provider. You won't be asked. You'll be told at what fee. So we're talking about price controls. And if we know every country that's managed price controls, all we know is supply vanishes if the price isn't realistic. So very realistically, this could actually decrease the level of access to healthcare rather than improve it. There's a procurement committee that will do the centralized national procurement of all services around, such as medicines, materials, consumables. We are talking tenders here that will be hundreds of billions. It's big. It can be big numbers. I can't remember the number on medicines in South Africa, but it's big. So that procurement committee will be responsible for deciding with tenders, but we all know how tenders work here, in terms of getting the services in for the national services, the centralized stuff. Section 24 of the NHI bill says that the board can create any number of committees it so desires, with any functions it so desires, in order to achieve its objectives. So, yeah, all of these, the board and all these committees and all members within each of these boards and committees is appointed by one person, and that's the Minister of Health. So we have a concentration of power and authority here, which is, you'd have to say, is enormous. There are no checks and balances. There's no discretion in the bill that says those appointees need to be ratified, say, by Parliament or any other body. It's totally at the discretion of the Minister of Health. Okay. Good governance structure, would you agree? A la South African style. Okay, so the risk of grand corruption. NHI will have political appointees. Okay, so that in itself, one sentence tells you probably all you need to know. Chief Justice Zondo, well, he was then not Chief Justice, but he is now, when he ran the Zondo Commission. And I mean, he recommended a complete revamp of how the appointments are made in SOEs, for obvious reasons. Even the President himself said, quote, that the manner in which those appointments were made was a massive system failure. His words. But yet the NHI bill entrenches this massive system failure. So why the duality in terms of position? If you want to avoid that massive system failure, then that governance framework needs to be completely scratched out and redrafted from scratch. Not that I'd suggest that, because the whole thing in itself shouldn't go ahead. I'll again quote from RW. I apologize for the repetition, but I do enjoy his stuff. He wrote this in Fighting for the Dream. It's about 5 years ago, I think he published this book. And there he said, the proposal to commence NHI by pouring hundreds of billions of rands of taxpayers' money into an NHI fund and place it under state administration was simply asking for more looting. And then he concludes, anyone who doesn't know that simply hasn't been paying attention. Okay, so quite a powerful statement, but totally apt.